Welcome to this e-learning module entitled Initial Diagnosis of Acute Heart Failure. Please select your educational material. This educational program is derived from the 2016 ESC Guidelines for the Diagnosis and Treatment of Acute and Chronic Heart Failure and the 2015 Consensus Paper from the HFA of the ESC, the ESEM, and
acute heart failure refers to a rapid onset or a worsening of symptoms or signs of acute heart failure.
This comprehensive course begins by looking at the definition and epidemiology of acute heart failure. Click on each box to learn more. The diagnosis of AHF may be difficult because many of the symptoms and signs are non-discriminating. Most of the patients with AHF present with normal or high blood pressure and with symptoms and/or signs related to congestion rather than low hypoperfusion. Chronic heart failure, HF, is associated with a high burden of mortality and morbidity, reduced quality of life, and increasing healthcare costs in Europe as well as across the world. Acute HF in particular is a serious health problem. This section will review the symptoms and signs of acute heart failure. Symptoms and signs of AHF related to congestion are the most frequent. By contrast, symptoms and signs related to hypoperfusion are less common but reflect severity of AHF. Please sort out the signs and symptoms in the appropriate category and click on the button to check the answers. However, as sensitivity and specificity of symptoms and signs of AHF are often not satisfactory, careful clinical evaluation needs to be followed by additional investigations. Professor Mabaza will now discuss the take-home messages from this course.
I hope you enjoyed this educational course on acute heart failure. We gave you really the up-to-date items on the management of acute heart failure. I hope now you are convinced that it is a life-threatening condition, that the diagnosis in patients coming with acute dyspnea should be done very quickly in favor or not in favor of acute heart failure. And if the patient has a clear evidence of acute heart failure, and we showed you that there are a modern way for the diagnosis using long ultrasound, using natriuretic peptide. When the diagnosis is assessed, the patient has an acute heart failure, then I hope now you will manage your patient very quickly by giving quickly the right medications, mostly based on vasodilators, a little bit of diuretics, and non-invasive ventilation. And most importantly, I hope we convince you that those patients cannot leave the emergency room, the cardiological ward, any ward